I'm Amanda. I'm helping on the admin side. You're welcome to unmute and start your presentation screen share. You have 8 minutes to present, and then we'll do some questions.
All right, I got it.
Perfect.
All right, ready?
Yep, the floor is yours.
All right. Good morning, everyone. Thank you for giving me the opportunity to come and speak with you today. I am here on behalf of the Active Women's Health Initiative, and that's in the Sports Medicine Research Institute in the College of Health Sciences here at UK. And today I'm really excited to share with you our Leaders in Health program that we've been working on. I would be remiss if I did not introduce the team that has been working alongside me to design this project and will be alongside me as we implement it. We are a diverse group of interdisciplinary scientists and medical professionals who are ready and willing to really engage with our Leaders in Health program. And we're committed to this program because it is part of our mission as the Active Women's Health Initiative to promote health across the lifespan for girls and women. This particular program is really part of our educational efforts where we are working to train the next generation of leaders, women leaders in health and healthcare. So the rest of my presentation will focus on the Leaders in Health program. Quite simply, our goal with this program is to prepare female undergraduate and graduate students for leadership positions and health-related careers. So just a few slides on why we still need to do this, because some of you may be thinking, wow, I thought most of our health professionals were women. And the reality of that is absolutely true. Over 80% of our healthcare professionals are women. But as you can see here in this figure of women as a percentage of total employees, women make up a large percentage of our registered nurses, our nurse practitioners, even medical school graduates. We're about 50-50 men to women. But as you get more specialized and in more leadership roles where women could potentially be making decisions to impact the health of people in our nation, like our hospital leaders, our healthcare company CEOs, quite frankly, women are not at the table making those decisions. But this is not just an issue of representation. This is also, for women, this is also a diversity issue more broadly. The demographics of our country are changing. The Census Bureau suggests that by 2045, the majority of the United States population will be current racial or ethnic minority groups. But we also know that right now, individuals in our health diagnosing and treating practitioner occupations, those are our doctors, are predominantly white. Our health leadership needs to reflect the diversity in our population, because when our health leaders reflect that diversity, they're able to provide care in the social and cultural context in which people need that care. Unfortunately, the story doesn't end there for inequality. We also see inequality in pay for women. Even when women become surgeons and physicians and make it to those predominantly male-dominated roles, they make 33% less than their male counterparts. And this one really gets me. Even in fields where women are the predominant workforce, like healthcare support roles, our nurse aides, certified nurse assistants, women in those positions are making 17% less than their male counterparts. So we believe that leadership is a big part in this, not only teaching women themselves to be leaders, but putting diverse women leaders in positions of power. They can make decisions that reduce some of these inequalities. So we've created the Leaders in Health program, and we're asking for your support for this program to provide opportunities to build personal leadership capacity, applied leadership experiences, and role modeling and mentorship for women leaders. Here are a few more details about the program. Our goal is to recruit graduate student facilitators who will lead this program alongside of us. They will be involved in every aspect of creating the program, the content for the program, including recruiting 30 diverse female undergraduate participants who are interested in health-related careers, and those students could come from anywhere across the university. And they'll be recruited into this year-long leadership program that's facilitated by our faculty. We will offer monthly professional development seminars. These might include panelists, speakers. They will give students the opportunity to learn about their own leadership capacity in a health context. And again, these will be led by the graduate student facilitator team. We'll also provide hands-on leadership experiences. So as part of the Active Women's Health Initiative, we run an outreach program called Girls Can for girls in kindergarten through 8th grade. And our leaders in this program will be involved with that program and have a hands-on opportunity to teach younger girls, that next generation of women leaders, about health and healthcare. And this is the part that I'm most excited about this program. Throughout the entire program, we have woven in interactions with women leaders in health on multiple levels. We will recruit diverse women leaders to come and speak to our students. We will have graduate students serving as mentors for small groups of undergraduate students, so they get that practice of being leaders themselves. And then finally, all of our participants will be leaders as they go out into the community and teach young girls about health and health professions. So every individual in this program will have the opportunity to not just learn about leadership, but to do leadership, to practice leadership in a real and meaningful way. So we are asking for your support to help us prepare this next generation of diverse women leaders in health careers. Your support would provide stipends for our graduate students who are going to take a very hands-on leadership role in this Leaders in Health program. Scholarships for the 30 undergraduate Leaders in Health participants, and funds for supporting student learning materials and professional development sessions. And before I take your questions, I just wanted to leave you with quotes from two young women who unfortunately are past or wouldn't be able to take advantage of this program, but they are currently interns with the Active Women's Health Initiative. And when I told them what I was working on, they shared these thoughts with me. The first one is from Brianna McCauley, who is a recent Transy grad in health and exercise science. She says, quote, "I wish to pursue a public health career because the need for social justice and health equity is extremely important to achieve in our communities. Having a leadership position in a health program can help me develop the skills to achieve social justice and health equity in my community." When I asked Savannah Black, who is a sport and exercise psychology master's student, she said, quote, "Following the completion of my master's degree, I am pursuing medical school in hopes of becoming a neurologist. Representation matters. And if my presence in the medical field as a doctor can inspire at least one person to know that their goals are attainable, then that is all I need." We're hoping to inspire at least one person, hopefully a whole lot more with your support. I thank you, and I will happily take any questions you have.
All right, Dee, you've got a couple of questions in the chat box. I'll pass to you.
Okay, great.
First one is, how will you evaluate the success of the program?
Yep. So I think the first success we're going to look at is to make sure that we are able to recruit a diverse group of students. If we can't do that, I think we've been unsuccessful. So that is maybe by racial or ethnic diversity, first generation college students, family, socioeconomic status. That is our primary goal, is to recruit that diverse group of students. And then we will look at their attitudes and their beliefs about their own leadership capacity before and after the program as well. Great question, thank you.
Next question, what field will the graduate students come from? Is it public health?
They could come from public health, but they, you saw Savannah is in sport and exercise psychology master's student. That's in the College of Education. She would certainly be well qualified for this type of position. So they could come from any health related, as long as they're interested in health and they have a career plan that they would outline to us, we would happily invite them to the program.
Next question, what is the minority undergraduate population in the college that you would be recruiting from?
Well, we're recruiting from across the entire university. So I'm not sure the exact numbers there.
And then the last question, is there a current program? Or is this a current program?
This would be supporting the inaugural year of the program. So we're in the development phase, and we're hoping to kick it off next year.
Any other questions from the group? You're welcome to unmute if you prefer to ask that way. All right, it looks like that's the end of the questions. Thank you so much.
Wonderful. Thank you all.
Perfect timing. Thank you.
You're welcome to close the screen share and then close out of the meeting.
Got it.
Thanks, Dee. All right, great job, y'all.